I am so excited to talk about this topic because this is a topic that borders on our women and their infants or their children in utero. Now we want to look at Rhesus disease. What is Rhesus disease and how can a woman have Rhesus disease? Rhesus disease is a condition whereby a woman's red blood cells produces antibodies. What do these antibodies do? They cause destruction to the red blood cell of the baby, either in utero or a baby that has just been born. This disease is transferred to the baby while the baby is in utero. Now, what causes Rhesus disease? How can a woman have Rhesus disease? Which women are predisposed to Rhesus disease, and how can this be prevented? We shall talk about all this in this video. If you are just joining us, I am Sister Zoe Augusta. I am a sister of St. Louis. I am a nurse and also a midwife. I say thank you to all our returning subscribers. And if you are just joining us, ensure you click on the subscribe button, turn on your notifications so that you always get notified anytime we upload new videos. You can also follow us on all our social media platforms. We're on Twitter, Instagram, and Facebook. Make sure you watch this video to the end because it promises to be very interesting. Do not go away. We'll be right back. Welcome back. I've told you that this topic is very interesting, so grab a glass of water, take a chill pill, also get your pen and paper. Let us begin. Now, Rhesus disease does not cause harm to the mother. No, it causes harm to the baby. Rhesus disease also occurs in women who are Rhesus negative. When somebody is Rhesus negative, it means that there is no Rhesus factor present in that individual's blood, in the red blood cell. Now, for a sensitization to occur in the woman and for these antibodies to be produced, it means that the woman is pregnant or has been pregnant with a baby who is Rhesus positive, and during the process of delivery or during the pregnancy, the baby's blood, which is Rhesus positive, is transferred to the mother, and there is reaction, and this reaction is what produces antibodies. If antibodies are produced, either during that pregnancy, these antibodies might be transferred back to the system of the baby, or for subsequent pregnancy, this antibody gets to the system of the baby. And if the baby is Rhesus positive, because the antibodies are coming from a woman who is Rhesus negative, there is going to be reaction. This reaction is called Rhesus sensitization, or it's called isoimmunization. It is this isoimmunization or Rhesus sensitization that causes destruction to the red cells of the baby, and this destruction can be life-threatening. This Rhesus sensitization or isoimmunization is also referred to as Rhesus incompatibility. There is incompatibility because the woman is Rhesus negative and the baby she's carrying in her womb is Rhesus positive. So the antibodies that have been produced will be transferred through the placenta barrier to the baby, causing destruction of the red cells of the baby. This destruction can lead to anemia, it can lead to death in utero, it can also lead to miscarriage or abortion that the woman might be experiencing subsequently after the present pregnancy or even within that pregnancy. So for Rhesus disease to occur, it means that the woman is Rhesus negative and that she has had a baby that is Rhesus positive, or the present pregnancy is Rhesus positive, and that there is production of antibodies within the woman. These antibodies is transferred from the blood of the woman to the blood of the baby. It is these antibodies that causes destruction of the red cells of the baby that is life-threatening and that can even lead to death of that baby in utero. Now, these antibodies that causes destruction of the red cells of the baby, once it is formed in the system of the woman, it cannot be getting rid of. So the best thing is to prevent the formation of these antibodies. And how do we prevent the formation of these antibodies? Is by taking an injection that is known as immunoglobulin. This immunoglobulin injection helps to prevent the formation of these antibodies. And the best time to take this immunoglobulin injection is between the 26th and 28th week of pregnancy. This injection is known to last for about 12 weeks if it is taken at that time. Then a woman is also advised to take this injection after delivery, within 72 hours after delivery. She's also advised to take it. This injection will help to prevent the formation of these antibodies that will cause destruction to the baby in utero or when a baby has been delivered. Rhesus disease, Rhesus incompatibility, Rhesus isoimmunization, Rhesus sensitization, all this only happen if a woman is Rhesus negative and has delivered a baby who is Rhesus positive, or is pregnant with a baby who is Rhesus positive. If a woman is Rhesus negative and she has a baby that is Rhesus negative, there is no problem. There won't be any iso sensitization or iso immunization. But if the baby is Rhesus positive, then iso immunization is suspected. So she needs to prevent this iso immunization by taking this immunoglobulin injection. Other ways to also prevent it is that the woman should avoid miscarriage at all costs and abortions. Then the woman should also avoid all invasive procedures that can lead to the mixture of her blood with that of her baby in utero. All this will help to prevent the iso immunization or the Rhesus incompatibility that may be occurring in a Rhesus negative mother and her Rhesus positive baby. I told you that this topic is very interesting. If you're a Rhesus negative woman, before you get pregnant, be prepared to take your shot of immunoglobulin injection. This will help to prevent the isoimmunization or Rhesus incompatibility that may be occurring between you and your baby. If you have found this video beneficial, give us a thumbs up. Share this video with your loved ones. You might be saving a life. This is me saying thank you to all of you who have watched this video to the end. I still remain Sister Ozo Augusta. Keep following us on Body Gist while we keep giving you healthy gist till we come your way again. Thank you, goodbye, and anticipate us in our next video.